That's
use?
the one you use.
Right. So, I mean, first thing we want to do when we open it up is determine if it's a left or a right side of the heart, right? So, thicker sides left, thinner sides right. In between here is the interventricular septum. Also, while here, I mean, anything in this gray area would be the myocardium, right? Anything shiny on the inside would be the endocardium. Anything on the outside of the heart would be the... There you go. So, just turning it around, if it's attached to, if it's something tagged here that's circled like a string, it's going to be the chordae tendineae. If it's actually at the top of the string, right, it's going to actually be the AV valve, right? So let me probe. Doctor?
Okay, so if it's the gray, and point to the gray matter again. If it's gray.
If it's gray, it's myocardium.
Okay.
So, I mean, if I pointed right here, I'd have to say, what? You know, is this a layer of the heart, or what is this actual structure? What's the structure? The structure would be the interventricular septum. The layer of the heart would be the myocardium. Thank you, Brady. So, chordae tendineae, and again, if it's up on a cusp, it's going to be a valve. AV valve. Right, and remember, aortic and semilunar are going to be in the book. So, and again, the way that we're gonna do the which vessels is, you know, again, which hole it's going into. So, if it's going into this hole right here, well, we can find it, right? If the probe is sticking clearly down here,
It's the aorta.
it's aorta.
Right.
If it's sticking into the left atrium, what's it going to be? Into the left atrium. It'd be, yeah, I mean, or
Or the inferior.
it doesn't make a
Vena
difference.
cava.
Either one, right?
Superior, inferior,
Did you guys say that right? Going into the left atrium would have to be the pulmonary veins, because it would have to be oxygenated. So pulmonary veins going into the left atrium. So there's a vessel going into there's a probe in here, and it says what the probe is inserted into which vessel. It's going to be the pulmonary veins, right? Because it's the left atrium. Oxygenated blood goes into the left atrium. If it's going into the right atrium, and I'd have to show you, I mean, a clear right atrium, but let's find this one's not good for a right atrium, but yeah, let's just say up here, right atrium, what's going into the right atrium? The vena cava. And if it's going into the right ventricle, pulmonary trunk. So again, I got to clearly show you a right atrium and a right ventricle. So if it's in the right ventricle, pulmonary trunk, or you could say pulmonary arteries, right atrium, inferior, superior vena cava, left atrium, pulmonary veins, left ventricle. Exactly. Anything else on there?
left ventricle is aorta.
Capillary muscles.
Yeah, I mean, so papillary muscles we didn't really see. So they would be,
Want a picture?
yeah, I mean they would be these little
Bottom.
these little muscles down here at the bottom. So if what the chordae tendineae is attaching to would be a papillary muscle.
Okay. At the bottom.
Yeah.
Would that be more like a picture, or?
It's probably more like I wouldn't worry about it. It's probably more like that's what it's really like. But yeah, it would be more like a picture or whatever.
Okay.
Or you're not going to see it. One of the two. Anything else on here?
That's it.
So here's a nice picture. You can clearly see this is the right atrium. So if I stuck this vessel in here and it's sitting there, and it'll be sitting there just like that. It's going into the, bless you, right atrium, superior, or vena cava you could just put, right? Because we can't really tell if superior. So you just want to be able to distinguish that it's a right atrium from a right ventricle.
And then little auricles, you'll have like a little tag on that?
Yeah, so oracles would be these little guys right up here.
Okay.
These cute little guys. All right, next.
Take care.